Johnson County's 80 and plus residents are rolling up their sleeves for the COVID-19 vaccine. On this episode, hear how the pandemic has impacted this demographic and the relief offered by the shot.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. Phase 2 officially started on Monday, January 25th in Johnson County. Phase 2 includes a large group of people. So the Johnson County Department of Health and Environment has added tiers and additional subgroups eligible to get the vaccine. This week, it's those 80 and older, plus those who were in Phase 1 who didn't already get their shot. Phase 1 is also getting their second doses this week. Here to talk more about that is Johnson County Department of Health and Environment Director, Dr. Sanmi Areola, and Epidemiology Director, Elizabeth Holzschuh. They provided the latest on vaccine distribution during a news conference on Thursday, January 28th.
We're getting a lot of calls from people that are 71, 72, or 65, saying phase 2 is 65 plus. Yes, you do qualify. But like we've said, this is a very, very large group. So we are doing our best to prioritize even within that group. We still don't have enough vaccines. And as we get more vaccines and we continue to vaccinate more people, you will get more opportunity to get to you as we proceed. And so now, we would open up to the 65 plus, and I do want to spend some time talking about that. We have been clear throughout the process that this is a local public health system activity, meaning that it's not just the Department of Health and Environment, it is all the other resources in the county. It is our hospitals, and they're willing, and we've been working with them. Again, the key factor is they just don't have enough vaccine. But the good news is the result of that collaboration. We're beginning to see some of the results of that collaboration. Beginning next week, at least 2 of them, Advent and Olathe Health, will begin to vaccinate residents in the 65 plus category. Obviously, they would focus on patients that are already in their system, and that's a good thing. On our side, as soon as we get more vaccine, we'll begin to look for opportunities to fill in the gaps for those people that are not affiliated with those hospitals. And next week, when we get more vaccine, we expect more of the hospitals also to begin to vaccinate. So stay tuned. Obviously, read and follow instructions from those hospitals as you receive them. I also don't want them to get overwhelmed because I know they only have a few doses too. So patience by far is what we are asking everyone that's listening to us to exercise, that as we get more doses, we will be putting the vaccine into the arms of people as quickly as we can. And so that's ongoing. And the key part of it, which Ms. Holzschuh will talk about, is the small doses that's going to Children's Mercy.
Good afternoon, Elizabeth Holzschuh, Director of Epidemiology. Yes, so we have been working very closely with Children's Mercy Hospital in Kansas to really allow them to vaccinate the individuals in our community who are caring for our children. That is their patient population. They're very interested in trying to protect those patients. And so they have been really gracious and been excellent community partners and stepped forward and being very willing to really spearhead the vaccination efforts around our K through 12 public schools, our private and parochial schools in our community, as well as our child care providers, both home and daycare centers. And those vaccinations, we're very excited to have those starting next week. And the first round of individuals we'll be immunizing are going to be our special education teachers, as well as the staff at the School of the Deaf. These individuals have been at an increased risk during this pandemic, both those individuals as well as those students that they work with, because of an inability for individuals to be masked and masked properly. And what this means is those students have been quarantined multiple times, usually during the pandemic so far, meaning that they are having to go home for a number of days. They can't be in school, they can't be receiving these services. And so in an attempt to protect those high-risk students, protect those staff, we are going to move forward. In our first round, about 1,900 doses are going to go to vaccinating those individuals with our K through 12 schools and the School for the Deaf. And this is really being orchestrated through the school districts. So they are in charge of identifying individuals in this group to be immunized. In the following weeks, as long as vaccine supply stays where we think it is, we will move forward with immunizing a proportion of the public school staff, as well as moving into vaccinating childcare providers in our community as well. And those will again be run by Children's Mercy in partnership with the Department of Health and Environment. So if you are one of these individuals, if you are a teacher in a school district or in a private or parochial school, we recommend you reach out to your administration. If you are a childcare provider and you are looking for additional information, please reach out to Eldona Chestnut and our childcare licensing program, as all information around these immunization clinics will be funneled through those individuals.
Thank you, Elizabeth. And again, it's a marathon, and it's a long marathon. By far, the biggest hurdle that we are having to cross is availability of vaccine. And if we do, we are going to move quicker through these different tiers and categories and get vaccines into the arms of our residents as quickly as we can. Again, we are approaching this using multi-pronged approach. We are going to make the vaccines available through multiple providers in the county. Some of them you already have relationship with, where you get your flu shots. That's kind of what we're working on, while we're also working on filling in the gaps and providing vaccines to you. And I know you have a lot of questions, and I know that because of the volume of calls that we've been receiving from you. We're going to continue to do our best to answer those questions on websites and social media and different things. And we again ask for your patience. I do want to touch on one key question that we've been receiving about second doses. And I want to make that very clear. Number one, we have your second dose. So we're not using your second dose to give first doses. Second dose come completely differently, and they're shipped even without us requesting for those things. So they're here. You also don't need to go looking or go to other jurisdictions to get your second dose. Your second dose should be received where you got your first dose from. If you got your first dose through us, we will have the second dose ready for you. It is here. And I'm trying to address all the different questions that we're getting. In terms of the process, also, if your second dose is not due for another 2 or 3 weeks, we may not be communicating with you. Right now, we are communicating with people whose second doses are due next week. And the email and phone number went out yesterday and this morning with instructions on how to book a spot. We do need to spread things out for the hours that we are open, so we don't have everybody there in a 30-minute or 1 hour stretch, and our system becomes overwhelmed. That's why we are asking you to book an appointment and select some of the slots that we have in there. Next week, we have about 2,500 persons that are due their second doses. Those will be available. Those information have been sent out, and you just need to show up. And also important that it doesn't have to be exact. So say your second dose is due next Tuesday and you are working and you couldn't make it. That's okay. Come on Wednesday, come on Thursday. If appointment is available and you book an appointment, technically you can get your second dose up to 42 days from the time that you receive the first dose. So keep that in mind. There's no need to panic. We have the doses here. We are going to open up the appointments for you to book. We'll send the information to you. book those appointments, and you get your shot. If you can't make it that day, just book the next available day that you have. There's no need to worry about those. They're available, and that's the procedure that we're using.
So we are starting to get some information from the state of Kansas about the number of individuals in our community who have been immunized. And while the data does lag to some degree because it requires it to be entered at each site of the immunization, it appears as though at least about 30,000 residents of Johnson County have received their first dose. And again, this will include healthcare workers, individuals living in our long-term care facilities, as well as EMTs and other individuals in phase 1 and starting into phase 2. So particularly in that 80 and above category from this week. And so that 30,000 have received at least their first dose. And we believe somewhere between about 5,000 and 10,000 individuals in our community have received their second dose. We will continue to work with the state of Kansas to continue to obtain this information on a routine basis and try and get that information out as regularly as possible.
Next up, we have with us Debbie Collins with Johnson County's Aging and Human Services Department. Thanks for being here.
Thank you for having me.
All right. Well, first off, can you just talk a little bit about your department? There was recently some reorganization, so not everyone's probably familiar with Aging and Human Services. It was previously Human Services. Can you talk about that?
Sure. Well, the reorganization was really an effort to try to place more emphasis on the aging side of the service programs that we provide. And so by taking the housing program out of Human Services and moving that over to the planning department, that really freed us up to spend more time and place more emphasis on the aging issues, because as you're probably well aware, and I'm sure most of the listeners are aware of, the increasingly larger population, the growing population of people who are over the age of 60, which is really, that's the threshold that we start serving people on the aging side. So we have well over 100,000 people right now in Johnson County that are 60 plus, and about 20,000 of them are 80 and older. And those are the folks that we tend to focus the most on, because they, the older you get, the tendency to need more supports and services increases.
Can you talk a little bit about sort of the specific aging services that residents are receiving?
Yeah, that's where I was going next. So our AAA, the aging side of our department, actually provides a number of different types of services that are beneficial for people age 60 and above. Information and assistance is one of our largest programs. We get calls all day long from people that are looking for information about long-term care, various different aging services, caregiver support, in-home services, various different issues that people are having because either they or a loved one is experiencing some difficulties in remaining in their home. So we have a fantastic group of people that provide information and assistance to those folks. And I would just put in a plug for the phone number, which is 913-715-8861. So if anybody is needing that kind of information, please feel free to call us.
So when we talk about the pandemic, it's had a huge impact on this demographic. We're talking about being higher risk for complications, hospitalizations, and death. So they've been spending a lot of time in their homes too. And luckily you've been able to provide some services to them during this pandemic. Can you talk a little bit about just how COVID has impacted them? What are you hearing?
Well, for sure. COVID has had an impact on every single individual in our community, but probably even more so on people that are older. Our older adult population already have issues with isolation and loneliness, and COVID really just kind of sealed that deal shut. Those who are lucky enough to have family members in town kind of had to stop visiting, with their family members. It really did have an impact on their ability to see other people. Many of the folks who are still mobile and can still get out into the community are very hesitant because they're nervous and worried about the fact that they are older and that they are more susceptible to getting the virus. So their visits to grocery stores and whatnot have been very limited. Essentially, it's just they have really felt a much stronger sense of isolation than probably the rest of our population. And that oftentimes leads to depression issues, which is never an easy thing to treat. But so, my advice to anybody who has a loved one who is an older person here in Johnson County or anywhere is to do what you can to try to keep connected. Telephone calls are great. Unfortunately, technology has kind of connected the rest of the world, but many older adults don't have access to technology. They don't have laptops or computers at home. They don't necessarily understand or know how to use the technology that could potentially keep them in touch with their loved ones. So that even adds to their sense of isolation, where the rest of us have kind of been able to adapt somewhat, through the use of technology.
You talk about the isolation and then also the health consequences of the pandemic. I mean, all those are serious issues that are impacting this group. How important is it that they have the vaccine? And what are you hearing from them about their, I guess, maybe anticipation of that?
Well, it's been very clear, especially since phase 2 has opened and now people over the age of 80 are eligible to get the vaccine. Been very clear that people are anxious to get it just by virtue of the great turnout that we've already had and seen in the vaccination clinics. They are anxious. They are for the most part, really very excited to get the vaccine and kind of look at this as sort of the end of the pandemic, even though, they are always coached to continue with all of the universal precautions that we put in place, like masking and social distancing and all of that. But this vaccine is the light at the end of the tunnel for many of our older adults. Some of them are still nervous and worried about, the side effects and that sort of thing. And that's a normal reaction. But for the most part, the people that I've talked to and the folks that we have interacted with have been really excited to get the vaccine and are very grateful that they've had the opportunity to do so.
All right. And just last question for you. If we have some of our listeners in the older adult category, how can they get in touch with you? You mentioned the phone number. Is there a web page where they can get more information as well?
There is. The Aging and Human Services Department does have a web page that is part of the Johnson County's overall. You can find us on the JoCoGov.org and go to Aging and Human Services under departments. So you can reach us there or give us a call at that 715-8861 number, and we can get started with whatever services and questions you might have.
All right. That is all great information. And thank you again for being with us. I know our listeners will benefit from some of the information you've shared today.
Thank you, Teresa.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.